The news day continues here on One News Now. I'm Riza Diaz. The Health Department reports over 16,000 new COVID-19 cases. This brings the country's total caseload closer to 1.83 million, some 125,900 of which are still active. 460 duplicates were removed from the total case count, 427 of which were reclassified as recoveries. 215 more COVID deaths were confirmed overnight, bringing the death toll to 31,800. Now, total recoveries are at 1.6 million, with nearly 14,000 new survivors in the last 24 hours. 120 cases previously tagged as recoveries were reclassified as deaths. 25.5% of the 65,500 people tested for today's COVID-19 bulletin yielded positive results. The growth rate of new COVID-19 infections in Metro Manila has decreased according to the OCTA Research Group. According to the group's latest monitoring report, the capital region averaged 3,819 new cases per day from August 15 to August 21. This is only 24% higher than the previous week's tally, but lower than the growth rate of 48% 2 weeks ago and 72% 3 weeks ago. Now, the group said this shows that the surge in new infections has slowed down. Meanwhile, the current reproduction number in Metro Manila is 1.67. This is lower compared to last week's 1.90. OCTA Research said the 2-week ECQ helped reduce the spread of COVID-19 infection. Now, to share more insights based on this data, joining us tonight on the line is Professor Guido David of the OCTA Research Group. Sir Guido, good evening.
Hi, good evening, Riza.
Professor, can you explain to us why is it important to be looking at the growth rate when is this relative to the base from the previous week?
Yes, it is relative to the base, but the growth rate is still related to the reproduction number that we calculate every almost every day. So the reproduction number indicates the trend if the cases are moving up or going down or accelerating or decelerating.
And Professor, how is this different from comparing the actual average of new daily cases?
Yes, well, the average of daily cases gives us the level of, how many cases were reported. But the growth rate compares if the cases this week are higher compared to last week or lower. And before we go on a downward trend, the growth rate must first decrease to about 0, and then it will become negative. So what I mean is it will not become negative growth rate all of a sudden. It must decrease first and become negative. And this is what we have seen during the past lockdown. So even back in March, in April, the growth rate was decreasing until it became 0 and it became negative. Then we were on a downward trend.
Professor David, was the 2-week ECQ enough to stem the surge in new infections?
Well, I can't say if it's enough. I mean, we can't say that right now. We will have to see what the effects of this new MECQ is. I mean, I would call it new, but what I mean is, this newly implemented MECQ. We hope that it's enough. We hope that we will be able to sustain the trends and the gains over the next 2 weeks of MECQ.
Well, we're certainly hopeful for that. But, Sir Guido, what do you think can we expect now that the restrictions have somehow eased?
Well, I would say that the restrictions have not been loosened by a lot. In fact, I would say that relatively the restrictions are almost, I would say identical, but they're quite close in terms of the level of restrictions. And in fact, this is also what happened last March to April during the ECQ. We had 3 weeks of ECQ, and we followed that with 4 weeks of MECQ. And the 3 weeks of ECQ was sufficient to reduce the number of or at least reduce the reproduction number, because we weren't on a downward trend yet after 3 weeks of ECQ last April. And then after that, when we switched to an MECQ, the trend continued. So this is what we're hoping will happen this time.
Professor, the reproduction rate has gone lower at 1.67, but this is still way above the ideal one. What other measures do you think should be in place so that we can achieve that?
Yes, you're correct, Riza. In fact, based on what we're seeing in the past, it may take us 2 to 3 weeks or even longer to reduce the reproduction number to less than 1. What we need, of course, is the cooperation of the people in terms of following minimum health standards and, not having social gatherings. And if some people are feeling some kind of symptoms or not feeling so well, I mean, it would really help the community if they self-isolate already. Now, as far as the local governments, of course, we should continue to have contact tracing, testing, and early quarantine, in order to help decrease the reproduction number. And that also includes having continued biosurveillance and having localized lockdowns if needed.
Sir, let's talk about the Delta variant. How do you think this is affecting the COVID-19 situation in our country?
Yeah, we think that the Delta variant is really prevalent at this time in the NCR. We think it is the primary source of transmission or infection in the NCR, because based on the most recent genome sequencing, what we're seeing is that the Delta variant is maybe close to 50% of the sampled cases. It might be higher now, and we strongly feel that it is driving the surge, because the surge was accelerating. Now it's no longer accelerating because of the measures and the interventions. But this is not just happening in the NCR. It's also happening in Calabarzon and Central Luzon. We think that the Delta variant has spread to these other regions.
So Guido, the Burmans is just around the corner. At this point, can we realistically expect perhaps a mask-free Christmas for us?
Well, at the minimum, I think we could be optimistic that our Christmas will be merry, in the sense that once we are able to go over this hump of the Delta variant, which I believe will happen within September, it will probably not last until October. I mean, at least that's what we're hoping. And what we're seeing right now is that we will have 3 good months from October to December of, not really having a surge, especially since we're vaccinating more people now. We have at least 30% fully vaccinated in the NCR. Now, I can't promise a maskless Christmas, but this is also possible if, for example, Riza, you have a social gathering where your attendees are mostly vaccinated people. I think maskless would be possible in that scenario. But in public areas, for example, in the malls, I don't think we will be maskless yet, even at that time.
All right, thank you, sir. That was Professor Guido David of the OCTA Research Group. Meanwhile, one hospital group is considering to cut its affiliation with PhilHealth following a recent circular. Patients now fear that the discounts they get in hospitals from PhilHealth may no longer be available. Camille Samonte has the story.
Discounts from state-run insurer PhilHealth come in handy to dialysis patients like Alberto Duran. His dialysis costs more than 4,000 pesos per session, and he does this twice a week. But thanks to his PhilHealth discount, he's only paying half the price at a private hospital in Pasay City. Duran said it would be difficult for him to continue his treatment without the PhilHealth subsidy.
Talagang mahihirapan kami, baka mapaaga kami mamamatay kung bihira lang kami mag-dialysis.
Ramon Macaraig, meanwhile, has to borrow money every week to be consistent with his dialysis. He is paying only 1,000 pesos per session, but he is now concerned that he might have to pay in full. This as some private hospitals are now reviewing their engagement with PhilHealth.
Ito nga lang pandemic, nagkakanbaw na kami ng utang.
Bakit?
Eh, siyempre, kailangan naman dialysis eh. Eh, kung hindi naman pwedeng ipagpaliban din.
PhilHealth recently released a circular which temporarily suspends payment of claims of hospitals. This covers those under investigation for fraud, unethical activity, and abuse of authority. The agency said the policy is just a preventive measure to avoid loss of funds to irregular claims. But for the Private Hospital Association of the Philippines, this policy is just a tactic to delay payment claims. PhilHealth allegedly still had over 86 billion pesos unpaid claims to hospitals across the country.
Halos hindi po kami nababayaran. Kaya yun po, yung utang na sinasabi nila, sabi nila in process right now, ay yun po ang hinihintay namin na talagang maibigay nila.
De Grano noted that some of them are now thinking not to renew their PhilHealth accreditation. When this happens, patients will now have to pay for their own medical bills without subsidy from the state insurer.
Siyempre, ang ating pasyente will have to get from out of their pockets. Ano? Kung halimbawa pong matuloy yun, ay hindi po sila, maa-admit po sila. Meron pa rin po ang benefits nila. May benefits naman po sila, hindi naman mawawala yun. Yun nga lang, dahil pagka nasuspend po ang aming mga payments na ganyan, saan po kukunin ng ospital ang ipagpapatuloy na serbisyo namin.
But De Grano said they will continue to serve PhilHealth covered patients until the end of their contract.
May enough time po na mag-decide ang mga hospitals at saka mga doctors kung itutuloy pa po namin ang aming renewal sa PhilHealth. Eh kasi po ngayon, karamihan sa kanila ay ayaw na.
PhilHealth meanwhile assured its members and accredited providers that all good claims will not be affected. For News 5, Camille Samonte, we are One News.
Here's a quick look at today's other top stories. Despite the threat of COVID-19, the Commission on Elections says there will be no online filing of certificates of candidacy. The poll body said the COC should be filed by an aspiring candidate personally or through an authorized representative. The filing of COCs for the 2022 elections will be from October 1 to 8. National Police Chief General Guillermo Elizar directed units in Metro Manila to coordinate with local government units on outdoor exercise policies. Under the current quarantine classification in the capital region, outdoor exercises near home is allowed, but within a specific period. LGUs are given free rein to set the hours when outdoor exercising will be allowed and prohibited. And the vaccinated passengers can continue availing of free rides in public trains until the end of the month. Free train rides will only take effect during peak hours from 7 to 9 in the morning and 5 to 7 p.m. for MRT3 and LRT2 and 10 in the morning till 3 in the afternoon for PNR. Now, for more updates, visit News 5, the Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.